if we could focus on this chap, the 77-year-old chap with the
Sure.
swollen legs, because that sounded quite interesting.
Yeah.
Is that all right?
Yes, that'd be great. Yeah. I'd quite like to discuss him because he was quite challenging. So yeah.
Why was he challenging? What issues do you think it raised?
I think it was quite challenging to sort of act sort of holistically in his care, really, because what his aims were and what his desires for his medical care didn't necessarily marry up with what I felt was in his best interests, which made sort of...
So there was a conflict.
There was a bit of a conflict, yes.
Your agendas. Do you want to give a very brief summary of the case, just so
Sure.
that I understand?
Sure. This gentleman's a 77-year-old who has diastolic heart failure, peripheral edema in both his legs. He also has alcoholic cirrhosis and low albumin. 2 weeks before he came to see me, had actually been admitted to hospital because of a routine set of bloods had identified that his electrolytes were quite out of kilter. And that was largely attributed in hospital to the fact that he was on furosemide and spironolactone. Both of those medicines were stopped and everything seemed to improve. And I suppose the reason that everything became out of kilter was because in the first instance it was an admission to hospital which we had dictated to him. He felt well when he went into hospital. He was discharged quite quickly. I think it was about a week's admission. And really the only impact he saw on his health from that admission to hospital was that his legs became more swollen. So really his admission to hospital, in his opinion, had resulted in a loss of symptom control and worsening of his day-to-day living. And it was really with regards to that he came to see me. He had been advised to come and see his GP in hospital, and he really wanted to discuss further what had happened in hospital and what this meant for the future of his treatment, and specifically with his legs.
So he wasn't happy that his legs were swollen again?
No, he wasn't, and that was quite challenging, really, because he understood that the obvious solution would be to go back on the medication that we'd stopped, but it wasn't really something we could allow to happen, knowing that it could result in the same electrolyte imbalance that he had, which resulted in him going to hospital.
In the first place?
Yeah.
You mentioned at the beginning something about you thought it highlighted some difficulties in holistic practice. Is that what you said? So could you just expand on that?
Well, I suppose when I opened the consultation with him, he used the issue relating to his legs as his main issue. But it became quite apparent that his whole life had been affected by his medical care, and he was no longer really happy with that. He was having a lot of appointments at hospital with the heart failure team, and this was impacting quite negatively on his retirement. He had plans for his retirement. He bought a mobile home, and he planned to travel around with his wife in this mobile home. And because of the frequency of hospital appointments and almost requiring to come to the GP practice, once or twice a month, he couldn't really do those things. And I think that was causing quite a lot of frustration for him. And I suppose sort of acting holistically, listening to those things, it sort of couldn't help but empathise with him, but it seemed perhaps that his expectations were unlikely to really be realised. I can't really imagine a scenario where his health will be so stable that he will sort of realise that dream of travelling around in that sort of freedom.
Right. So that's very difficult when he's got these unrealistic expectations. How did you deal with that in the consultation? It
was quite difficult because it was difficult initially to try and work out why he had actually come to the practice. He had planned follow-up with the hospital, so I suppose my main aim was to try and find out why he was there and what he wanted from me.
Very good.
So he, his ideas about what he wanted his medical care to be, and his concerns about what was happening, in terms of his social life with his wife and his desire to travel, were having quite a negative overall impact on his mood. So I think after a bit of delving, it became quite apparent that that was his main issue that he wanted to bring up. We then tried to work together to try and find a way that we could in some way meet that overall sort of life goal, that he would be able to travel.
So interesting, he had a life goal, you had a medical goal.
Yeah.
Do you think it was successful? Do you think you managed to marry those two things up? Or?
I'd like to say yes, but I think actually it became quite difficult. I think it was the sort of issue that would require us having multiple consultations to really address entirely. We discussed at length what the options were for him, and we discussed why medication in the short term, while these electrolytes were still normalising, that they wouldn't be really appropriate. And we tried to, I tried to delve into some other options, like bandaging for his legs and elevating his legs and exercise and things. Unfortunately, a lot of those options, which were less driven around a medication that could solve his problems, were quite quickly quashed by the patient as things that he didn't want to try. He'd tried them before, and there were lots of roadblocks as to why they wouldn't work for him.
So his opinion was that the medication was the solution?
Yes, yeah.
You mentioned cirrhotic liver. Is he still drinking?
Yes, he was still drinking, although he says it wasn't an excessive amount. It was what he seemed as quite a reasonable amount. And we delved into exactly how much he drank, but he became quite vague around the actual quantities.
Why do you think that could be?
I think, it's hard not to be too prejudiced about that when you see sort of alcoholic liver disease and alcohol addiction on someone's past medical. But I would have thought that he was either worried to tell me or slightly embarrassed to tell me exactly how much he'd been drinking. I suppose retrospectively I thought that perhaps his drinking might have been reflective of his overall mood and how our sort of imposed admission to hospital had affected him overall. Yeah.
So he was feeling very imposed upon?
Yes, I think so.
Did you touch on the issue of alcohol and cirrhosis and whether he should be drinking, or was that something that you didn't quite? I think because it was our first time meeting, I didn't really want to get too bogged down in it because I sort of wanted to develop a bit of a rapport with him. Yes.
I think given the length of time that this has been a problem for him, it felt like a sort of young doctor in their training lecturing him would probably not be met with too much positivity, especially seeing as he was coming in a way to complain about the way that care had been delivered, or how he felt that care had been delivered in the preceding couple of weeks.
So you took on board his perceptions of the medical profession and tailored your consultation using that information. That's great. Did you ask about much about his wife? It sounds like there was a lot in this consultation already. What was his wife's opinion about this medicalisation? Yeah,
well, I think him and his wife had very differing views on what was required to keep him healthy and what was in his best interest, really. He did mention that with regard to his alcohol and his admission to hospital, that his wife had been very much positive about the fact that he needed to go. It was in his best interest.
So she didn't share his opinion that he was being over-medicalised?
No, not at all. And I also got the opinion that although it was a frustration for her to not be able to go travelling, she was more concerned about his health, whereas he seemed more concerned about the lack of travelling rather than the overall fact of how his health was progressing. So I think his wife really wanted him to be medically sorted out once and for all, and he really wanted to just be sorted out for long enough that he could go away and come back again.
And when you realised there was this divergence between what you were hoping to be able to offer him and the concerns that you had and his own opinion, what phrases, can you think of any phrases or anything that you said which helped to move the situation forward? I
think my main way of trying to move the situation forward was really to try and just let him tell me what he had hoped from the consultation, what he had hoped for his long-term sort of health plan. We did discuss options for his care. I asked him if he had any specific aims when he came into the consultation that he wanted me to sort of address or meet, any specific interventions that he had hoped I would offer him. And it became quite apparent that he didn't really have an idea besides restarting the medication as to what was available. So at that stage we discussed the options, and I asked him if he liked any of those options or could think of another option. But it became quite apparent that because I wasn't willing to restart the medication, that he didn't really like the options that I'd suggested. So we discussed potentially getting the district nurse in to help with dressings to his legs, or an occupational therapist to help him apply the stockings to his legs. And I think he saw those as further intervention from someone else, which was the last thing he really wanted.
Right. And did you touch on how the low albumin might affect his edema?
No, I didn't really touch on that too greatly. I think part of the reason was because, you know, all of that took quite a lot of time, but also because I think perhaps I was more preoccupied with his electrolytes rather than his albumin, and that was probably a bit of a failing on my behalf, that I didn't really address that better, because perhaps his malnourishment and his alcohol excess were playing just as much a part into it as his heart failure, really.
Were you aware that that affected your behaviour with him, the sort of worry that you had about the sodium? And, you know, obviously he was completely unconcerned. Why would he care about his sodium?
Yeah.
Did that affect how you were with him, do you think, or how you communicated with him?
Yeah, I'm sure it probably would have done, actually, because I suppose the important thing was that I heard his concerns and what he wanted for his future treatment, and acknowledged that they were concerning for me too. But I suppose in a way I had to impress upon him, because his ideas were unrealistic, the concerns that I had. So I suppose it's difficult to know really how he came out of that consultation, whether he felt that I understood his concerns or really brought my own concerns back to the fore, really.
Another thing you mentioned was his low mood. Did you screen him for depression? I mean, do you think he was depressed?
I think he probably was depressed. I felt like delving into it at that stage, again, wouldn't have really developed much of a rapport with him. Because we'd covered quite a lot in quite a long period of time. What we decided on in the end was that he needed to have further blood tests, and at which point I wanted him to come back so we could discuss the options we'd suggested. And I think at that point that would have been a more appropriate time to perhaps discuss those concerns
you've got
further.
All these things kind of in your mind which you're going to raise next time. No, it's true. We often use time, don't we, in general practice to develop the diagnosis. Are there any issues about this case you think that we haven't mentioned, or that anything else that you wanted to bring up?
I think those are the main key points that I wanted to discuss, really. And I suppose there was a little bit of a conflict between me knowing really what the right thing to do in that scenario was. Obviously, I knew that there was going to be a time lapse in me having to make a decision, because we had to wait to get blood test results as to whether or not his electrolytes are normalised, and we could think about reintroducing a medication. But I did sort of feel like I was reaching the limit of a comfort zone in terms of whether or not it would be appropriate to think about recommencing some of the medications which the hospital had recently stopped. So I suppose with that in mind, there was a certain area of me reaching the limit of my competencies.
Okay, well, I think that was an excellent case, Jo. Thanks. Now that we've finished the formal interview part, we can move into the formative stuff, if you like. We could perhaps have a chat about strategies, maybe when the patient's agenda doesn't quite match ours, or we have concerns which they don't share, and how to get people on board, or what to do. But I think that concludes the formal interview.
If you're a student on our postgraduate certificate course, you'll find references and suggestions for additional reading within the online resource folder.